Hi, and welcome everybody. We're excited to have you here as you're starting your adventure at Macalester College. My name is Jen Jacobson. I use she, her, hers pronouns, and I'm the Director of Sexual Violence Prevention Education here at Macalester. But like any good liberal arts grad, I'm cross-training across our curriculum, and I'm also working with our COVID team on campus. So we're looking forward to getting started today. So welcome to today's program. If you have any technical difficulties today, please use the chat box to send us a message. You can chat Macalester College directly for assistance. This event is being closed captioned. Use the closed captioning link labeled CC at the bottom of the Zoom window and click subtitles to show your subtitles. Once you've selected show subtitles, you will see an option to hide them if you wish to turn them off. Please use the Q&A button. I'm sure you're going to have questions. There'll be things that you want to know about that we don't cover. Use that button at the bottom of the Zoom window to submit your questions, and we'll hope to get as many as we can in today. We'll use the chat feature to share information and additional resources, particularly the host of different websites that have a lot of the information you might be looking for. We'd like to let you know we're recording today's program, and we'll have it available online in the future on the orientation webpage at www.macalester.edu/orientation. We're hoping for me and for Dr. Steph, who you'll meet in a minute, to spend 10 or 15 minutes just talking to you a little bit about this new era we're in of being on campus together in the COVID era, and a little bit about what we're doing on campus for prevention and risk mitigation, and then really to open it up to your questions. But again, I just want to say how excited I am that we are starting the academic year together. I've always been a school nerd and loved getting my school supplies and that kind of stuff. And the sense of energy when we're starting academics together again is really exciting to me. So we're so glad to have you with us again as part of our community. And even though this is a year that's a little different from what we expect, I'm really glad to be back into the academic year. So, Dr. Steph.
Hey everyone, it is a Friday at 4:30 and you deserve a special treat. I'm Dr. Steph. I am not the special treat. It's Kevin. He's the OG therapy dog, Paws at Max. Some of you have been following him on Instagram for a while. He has been asked to make a special appearance in this webinar because you deserve to have a moment of something other than COVID, which is mostly what we're going to talk about, but Kevin's here for your emotional support. Honestly, I've had enough of him in the pandemic, so I'm just trying to send all his well-intentioned energy your way. I use she, hers. I have been the medical director in the Hamre Center for 11 years. I still love my job, although this summer it really did feel like all COVID all the time. Full disclosure, when you hear the very witty banter between Jen Jacobson and myself, we have been friends for a long time. Those of you on this call with the Grinnell connection, we went to Grinnell together in the grunge era, late 90s, think extra large flannels and other things of that time. The main thing I want to do with you is first just validate some emotions that maybe some of you are feeling. There's probably quite a bit of confusion, some concern. Jen and I both want to very much validate that if you've seen stuff in the popular press about, you know, students messed up this reopening and students messed up that reopening, we very much want to help you build community. We know how difficult this is, and we really think that most folks really want to do the right thing. And I also want to acknowledge that when we medical field, we public health field, we Macalester say things like vulnerable population, that might include some of you. And I do want to remind folks a little bit about the why, like why are we doing this? I do feel like we've lost sight of that. And it's very easy to sort of direct frustration at all the guidelines and the masks and the this and the hoops that we have to jump through. But for each of you, if you could just remember those original goals at why places shut down, why governors issued lockdown orders, the main goal was to protect the most vulnerable. So just for a minute, that might be you, that might be a loved one, that might be a grandparent, and I don't pretend that any of you may have not already been touched by this pandemic and that it isn't abstract for you. So again, that's one of the main reasons we're doing this. Others of you may have folks who are in healthcare like myself, who are talking with and hearing from folks on the front lines, staffing emergency rooms, seeing this wave of illness keep coming at them. So again, that's the why. And the other thing I want to remind everybody is that this is temporary. Sometimes it feels like it's never going to end. We all have pandemic fatigue. That's very real. But this is temporary. Unlike other things, which, like systemic racism and folks with historically marginalized identities have been facing for a long time, this one actually probably will end when we get an effective vaccine. So whatever emotion you're feeling right now is most likely normal. Your friends are probably feeling it too, and I'm hoping it can help motivate us to do the right thing. One thing I say a lot in these webinars is also just reminding folks of some basics, just to not forget that even though we don't have a vaccine, and even though there was testing that took place this week, our best defense against outbreaks and further spread and COVID affecting ourselves or our loved ones or other vulnerable folks is this 6 feet of physical distancing and the mask wearing. So again, the basics, you are a close contact or an exposed person if you come within 6 feet for 15 minutes or more of a lab confirmed COVID case. So when we talk about things like isolation and quarantine, those basics of who was exposed, how many people were exposed, is what we're trying to keep at the forefront. One of the challenges, and the reason it's real easy for folks to sort of jump on college parties as the problem, and I'm not saying that they're not a challenge and not a problem, but it's not the only thing, is that let's say that I get sick tomorrow, I go get tested, I have my COVID test comes back positive in a couple of days. Minnesota Department of Health will be the next person on the phone with me saying, okay, Steph, can you tell us who has been within 6 feet for 15 minutes or more, whether or not a mask was worn? Those are the people that need to go into quarantine, and those are the people that are most at risk. So for me, I can say exactly who those 4 people are. It really hasn't changed since March. But if I was just at a social gathering, a funeral, I don't know why I thought of funeral. There's been outbreaks associated with funerals. A party, a social gathering, and I go, oh gosh, I don't know who I was within 6 feet of last night. And that's a real challenge at places like Colorado College, where they basically put an entire dorm in a quarantine because they really had no way of knowing exactly who met that criteria. So that's those are the basics. I just want to ground us in that, and I will turn it a little bit back over to Jen to give some other overviews about COVID.
Hello again. Yeah, we just want to, again, like Dr. Steph said, highlight the basics, really, and those main things of the 6 feet of physical distancing. And we're really intentional about saying physical distancing versus social distancing. We want you physically distanced from each other because we know that will reduce likelihood of transmission, but we want to find ways as a community to remain socially close. The face coverings, right, really important in indoor shared areas, and we'll talk a little bit more about what that might mean for your daily life in a minute. The hand washing remains important, that good hand washing for 20 seconds or more. We're finding in the Southern Hemisphere, which is, it's winter time there in flu season, they're seeing a lot less flu transmission. And we're wondering, is it the distancing and the face covering wearing and people actually washing their hands? Like, turns out those things work. There's a list of things that we want you to be thinking about, right? About disinfecting shared surfaces after you use them, and thinking about how you're limiting the size of any gathering you're at, the number of gatherings, and all of that is covered in the community commitment that not only you as students read and commit to as part of being on campus, but as faculty and staff, we've done that too, because we know that we're all in this together. And also more information walking you through a lot of those things are available. That 10-minute training video that was sent out to you, which happens to be due Monday. So if you don't fill it out by then, you're going to start getting some poke nudge emails. So get that done. But that will walk you through. And the goal is really to give people the information they need so we can do the things we need to do and make informed choices on how we're going to work together to keep each other safer.
Nice. All right, Kevin's breath is getting hotter and louder, so it's possible that he will be asked to exit this Zoom webinar, but I'll keep him on as long as it's not terribly distracting for me or you. Oh, okay, a request in the chat. Keep him on. Okay, let's see. We could jump right into what I think of as potty talk. Like, there's a lot of questions about bathrooms, which is totally understandable. I want to validate too that all of you have been living in a pandemic, and so you know the basics. Now the challenge is, how do we translate what we've learned about navigating life in a pandemic to potentially congregate living settings, college campuses? And one thing I would invite you is back to that thing we said where this is temporary, to just sort of let go to the best of your ability any notions of this is going to be the best year ever, or things that media tells us what college is, or for those of you that are returners, if there's OLs and others listening, this doesn't have to compare to college last year. And there are some silver linings in this about different ways we've been connected. For the first time, sometimes folks are thinking about being a global citizen. We're all in this together, and it's rare for a generation to learn this as early. My teenage kids may groan at me for this part, but they really have sort of leaned into that. I'm doing this to protect others. I have the privilege of learning from home. I have the privilege of my good health. I have the privilege of good Wi-Fi, and not everyone does. So that's the duty I'm asking them to lean into. Okay, potty talk. Yes, so most of you live in single rooms and do not have roommates. So you are sleeping alone for the most part. We will get to navigating sex relationships, friendships, and pods, I hope, if we have time. But you are also using shared bathrooms. So to the best of your ability, again, keeping those basics in mind, 6 feet apart if at all possible, masks when you're in shared spaces. No one that I know of yet has been able to brush their teeth through a mask or effectively wash their face through a mask or shower. You remain a human with human needs. You get to take your mask off to take care of that. But we are asking folks not to linger in the bathroom, not to chat in the bathroom, not to share space in there. There are some things about shared bathrooms that used to be fun, and some of that fun has to become remote or at least 6 feet apart when you do it. But yes, you are a human being with needs. You can remove your mask when you have to brush your teeth. What else do you know? Or what else do you want to know? Or Jen, what do you want to say about bathroom stuff? Or people chat more specifically bathroom questions in the chat, and we'll try to get to it while we're on the topic.
I think those are the big ones so far. What about when you're leaving your room and you're on the way to the bathroom in that shared hallway space?
Are you lobbing that to me?
Yep.
Okay. I smash it. Yes, ideally when you're leaving your room, you would put a mask on to go down the hallway. So again, like we realize that because we're humans, maybe we can't stay 6 feet apart from people all the time. But again, to meet the definition of close contact, you need that 15 minutes. So if you're going down the hallway to use the bathroom, if I lived in Kirk, I would mask up, because who knows who I'm going to see or pass by when we're there. And then you take it off when you brush your teeth, not on the way to brush your teeth.
There was a question that came in live, and while we're on the bathroom conversation, I'm going to go for it. Should we be cleaning off the sinks and handles after every use with the cleaning spray that's in the bathroom?
Ideally, yes. That's what it's there for. Right, Jen?
Yeah, I think, when we say the things that we can't help but sharing, we want to clean after use. I would think that would fall into it, because that also might be really high use in the time before morning classes start, in the time when people are kind of winding down to bed. So I could think about that would be really high, not high traffic of people being in there in the same time, but in a serial sense that people are in there one right after the other. I think a kind of a good rule, like I try to never pass a water fountain under normal conditions without stopping and getting a drink of water. I use that water fountain as my cue. I would think if someone has set out that disinfectant spray in an area, that's your cue that after touching the things that other people will touch, you should use that spray.
Yep, that makes a ton of sense. That's how I would think about it too. Many of you who've been following the science realize that the shared breath space is more of a concern, thank goodness, than common touch surfaces. So there are other viruses that love to sit on high touch surfaces. Think norovirus, the one that causes gastroenteritis, AKA stomach flu, not an accurate term, but basically puking. And that one is the one that you can very easily pick up from surfaces. Coronavirus is not one of those things. It is more shared breath space, but that is really difficult research to do, as you can imagine. Is, let's say, you know, I sneeze all over my laptop and then I ask a family member to use it after me. How many touches of my snot on the computer do they need to have before they've accumulated enough virus to infect them? And that's an answer we don't know about. So that's why partly we wearing masks. If you sneeze in the bathroom, it'll probably just go in your mask and you switch your mask because gross, not so much on a highly shared surface, but that's why we're trying to wipe down these surfaces to keep as few sort of accumulation of germs as possible.
Steph, on the list of things that you wanted to talk about was just talking a little more deeply about pods and the permeability of pods, or are, you know, do pods come pre-created, or how does that work? Does everyone get a pod? And what does that mean when you have a pod of friends, but like you touched on earlier, like you might want to have a sexual partner who's not in your pod. Can you talk a little bit about that?
Yeah, I hope we both can. So Jen and I spend a lot of time trying to like round this out for folks. Pod, unlike quarantine and isolation. Oh, speaking of terms, let's get specific. Isolation is for the ill person with a lab confirmed COVID case. Quarantine is for the close contacts of people. And then sort of self-isolation while waiting for your test results is that in between time where I got tested today, I am sick, I don't have to move to an isolation room, but I need to be careful of who I'm touching. What is not well defined is the term pod, but we realized very quickly that the word household, which so many sort of public health and medical entities were putting out there, that doesn't apply to a person living alone who has one sexual or romantic partner or two people in their pod or one friend. So how do we get folks to think about this? The way we think about it is that a pod is a closed circle. I'm just going to let that closed circle part sink in. And again, there's no one sort of like policing this for you. We're just trying to give you the most information you can so you can make an informed choice that works with your own risk tolerance and those around you. But for our purposes, a pod is a closed circle of the only people that you are going to get within 6 feet of without a mask, or within 6 feet of at all. So again, for me, like I said, I would know exactly who my contacts were if I got sick today, because I haven't been within 6 feet of anyone but those 4 people from the very beginning of this. You don't come here with a household like I do. I'm literally Zooming from my 12-year-old's room right now. You all are trying to build those friendships and relationships as you go, and that is really challenging. So the way I talked about it with the parent session today was that Jen and I also both do a lot of work on, well, Jen does specific work around sexual health respect and sexual health promotion, but that's part of my role too. If I was going to instruct somebody on how to have a really good, transparent STI risk talk with somebody that they were thinking about having intimacy with, I would, one thing that you can now add to it is, how many people have you been within 6 feet of in the last week or so? And how seriously are you taking this? What is your risk tolerance? Do you feel like you fall in one of those vulnerable adult categories where you want me to be extra careful? So it has this added layer where you're not maybe just talking about barrier methods or last STI test or whether or not you got your HPV vaccine. Now you're also talking about both partners or multiple partners being comfortable with your level of COVID risk exposure. So silver lining, you get to talk about everyday consent, which is like one of Jen's favorite topics and mine too. You get to practice being really transparent and having fully adult empowered discussions around sharing germs, whether sexual germs or not. But it is not easy because you didn't come here preloaded with a group of 3 best friends or partners or anything like that. You didn't even come here preloaded with roommates. So pods is a really tricky one. Jen, round it out for me.
No, I was going to say there's so much about the consent conversation, even with your friends, right? When you're thinking about forming a pod, what does it mean to your friends for that to be a closed circle? You know, what does it mean when someone says, well, I'll be really careful? It's really a lot of really good proactive practice at having communications around everyday consent. One more question kind of about thinking about spacing before we round back to some other things, Steph, is what does that look like outside, right? So we're still enjoying nice weather in Minnesota, maybe not right at this moment if it's still raining, but taking advantage of the beautiful weather in the cities in the fall. What does it look like to
I lost your last question there, but I know that you were talking about what does it look like outside. So here's a reminder. I'm going to give an example from my own life where I thought I was being good, but then I realized I was getting a little sloppy, and it was the outdoors that made me have a challenge with this. We met, my partner and I met two friends at an outdoor barbecue. We were sitting like at a picnic table, and we showed up and we said hello. And kind of before I knew it, I was like, I'm only 2 feet from Jean, and she's a doctor too. And so we both like, you know, kind of quickly backed up a little bit. But those situations, it's very easy when you're outside to be like, I'm outside, this is low risk. And it is lower risk, but it's not zero risk. That's a real reason why the protests, thank goodness that happened so that people could express themselves in that way, weren't a huge COVID explosion in the way that something indoors would have been. So outside helps a lot, and masking probably helps, but the science isn't as clear on that. But 6 feet apart is the thing that helps the most. So even when you're outside, that isn't an excuse to kind of like buddy up and just assume that the fresh air and sunshine is going to kill everything. To the best of your ability, still say 6 feet apart. My kiddo plays soccer, and I just suggested that the coach get hula hoops where they all dump their stuff, because the soccer's fine. They barely bump off each other. It's the before and after. They all dump their bags and their cleats in the same spot, and then they're clumping, even though it's outside, beforehand. And so sometimes you really need to think about, like, what does 6 feet apart look like? It does not look like this. Kevin's way too close, but 6 feet apart is significant. So do take advantage of this outdoor space while you can, but don't get sloppy like I did with my friends at dinner the other day.
Great, thanks, Steph. We're going to loop back to bathrooms for a second, right? Because this is important. It's something we use every day. And it's something that's really changed for us in COVID times, and changed for you all. You might have been sharing a bathroom with 1, 2, 5 people at home, but probably sharing with more now. So we have some questions about, do we need to disinfect the toilet seats? What about showers before and after use? And then sort of related, if we're wiping down things after using them, aren't our hands getting dirty all over again?
Yeah. Okay. I won't leave it at that. I love questions like this. So Jen and I, we should have said at the beginning that one of the things we really believe in sort of crisis communication, and we would both call COVID and pandemic a sustained crisis, is just acknowledging that this is moving quickly. We might say something today that we believe to the best of our ability, and then we get corrected tomorrow, and we will try to be as transparent as we can when we make those mistakes. But some of these bathroom details, like I have not been in your shoes. I have not had to move into a residence hall and really think about, like, what would I be doing at that time? So it's not a dumb question. After you've wiped something down, if it were me, you know, you're using a paper towel and a rag, I don't think of your hands as being significantly dirty at that time. I mean, maybe wash the hands right before you go, but think about the way our understanding of surface transmission has changed so much. Like, I was one of those people when I was first getting food delivered to the front door that was like Lysoling it or wiping it down. And then as the data emerged that surfaces probably aren't our biggest risk, I wasn't so much. So I would not think of your hands as dirty after you've wiped something down, but go ahead and wash them and get back to business after that. I don't know. No, don't worry about disinfecting toilet seats, right? I mean,
right. So, all right. So I'm going to move on to some of the logistics, which includes some bathroom logistics, about if you could walk us through about quarantine and isolation, because we have some questions about, if I am quarantined, am I still using the communal bathroom? If someone on my floor has tested positive, are they still using the communal bathroom? Can you walk us through what quarantine is, what isolation is, what that means in general, and what it means about shared bathrooms?
Yes, I'm going to do the best I can on this. Okay. Let's say you're 3 weeks into the semester, and either because you're doing the Campus Clear app or you just woke up with a tickle in your throat, you're like, uh-oh, I wonder if this is a sore throat or a fever. You have no known exposure, but you realize that anything that is a cold or flu type symptom or on that symptom checker means you probably should get tested for COVID. So you go into the Hamry Center and you get tested. There is a link now on what to expect after you've been tested right on our homepage, and maybe the Savvy Tech folks will drop that in the chat for us. We will be asking you, okay, please go home, wherever home is for you. If that's Kirk, so be it. And try to limit your contact with others until you get test results back. Let's say 3 days later, I am calling you and telling you, hey, your COVID test came back positive. My first concern is, how are you feeling? How does that affect your mental health? What resources do you need? We talk first about health. And then I say, please answer your phone. The next folks you will hear from, whether electronically or via phone, will be one of 2 people or entities. One would be Minnesota Department of Health. So COVID is a reportable disease. They automatically get positive results of COVID only anytime that happens anywhere in the state. They will be reaching out to you to ask that question. Who have you been within 6 feet of for 15 minutes or more in the last few days? And then you'll start answering that to the best of your ability. You will also get a notification from somebody on the COVID case management team. I sit on that team, and there's folks that are meeting every day to try to get these protocols in place. If you are positive for COVID, you will be transferred to a separate isolation room, ideally with its own bathroom, for either 10 days since you were diagnosed, or 10 days since you were had symptoms, and at 24 hours of no fever. That's when you'll be able to come out of isolation, and somebody from Hamry Center will be checking with you each day to make sure that you are feeling okay, that you don't need a higher level of care, that your health and medical needs are getting met. The COVID case manager, who's in charge of logistics, is getting food delivery arranged for you, communicating with disability services if you want them to on your behalf, making sure that you're able to access all that you need to remotely during that time. Let's say you knew of 4 people that you'd been within 6 feet of. Those folks are now going to be asked to go into quarantine. Go into quarantine means stay put. That is one thing about having single rooms that makes this much, much easier and potentially more sustainable for us here at Macalester. When you're in quarantine, there's a whole set of guidelines and stuff that comes with that. That too will be food delivery and so on and so forth, but you will not have to move to a different room. So the isolation rooms are for lab confirmed COVID positive cases only. If you become ill, if you were a close contact of somebody with a lab confirmed case, you will be asked to get tested yourself. Right now, the best infectious disease guidelines, it looks like that should be at about day 4 or 5 after your known exposure. So you would come to the Hamry Center, you would get tested, and we would communicate results to you. If you're in quarantine and that test comes back negative, can you move out of quarantine? No. So quarantine is 14 days from the time of exposure, even if you have a COVID test negative on day 4. And for the immunology nerds out there and the infectious disease nerds out there, that's because we don't necessarily know when the lab will turn positive. We don't know when you're most infectious. That's way beyond the scope of this webinar. Okay, there are 5, 10, 15 page documents about isolation and quarantine. So I'm trying to hit the highlights for you all. Jen, what did we miss? Or if you're a first year living in the residence, what are you most thinking about?
Right. So if you're in quarantine, you're staying in place, you're limiting where you're going, you are using the shared bathroom, but maybe using extra care to avoid other folks.
Yes. Okay, that's another thing. If you are in quarantine, the reason that Residence Life is notified is they are going to put a sign up on the bathroom closest to the person in quarantine that says this bathroom for quarantine use only. And they will direct folks who are able to go to a different bathroom while that bathroom is for quarantine use only. But yes, you are using extra care. You're not maybe coming, you shouldn't be coming in contact and exposing people in your bubble if they haven't already been exposed from the original person.
Yeah, and the last thing we'll round out is someone asked a question about how does the isolation room work with the students' items? And really that's something the COVID case manager will work to arrange, that you would have the things you needed in your new isolation room. So if you're able to continue to do coursework, you have your coursework, you have your favorite pajamas, all of those things. So we have some questions about testing and communication about testing. And I'll group them a little bit and you can kind of debrief them how you'd like. So someone wanted to know when we're gonna get our tests back from that first round of testing when folks came to campus. And then once everyone gets their results back from the initial test, what does that look like? Will we share the data out? And what does that look like in terms of sharing data out around questions? And then if people get COVID, will their names be announced? The first thing, like, I just want to lead off with thinking about when you just took the test, you're anticipating getting results. Remember, your results are a snapshot in time that will tell you at the moment of your test, you did not have enough viral load to test positive for COVID, right? So that's a great snapshot. The snapshot doesn't tell us either about the things if you went out and kind of ran to Target and stuff right afterwards and were exposed. It also might not tell us very well if the night before you came to college, you went and you visited with all of your friends for 15 minutes or more within 6 feet, you could have an exposure that hasn't shown up yet. So I just want to really moderate people's expectations. When you get that negative result back, that means great. At that snapshot in time, you did not have the viral load present to test positive for COVID. While we wish it were, it's not a free pass that says, I can't possibly be infectious to anyone else.
Thank you. Thank you, Jen. I am glad that you highlighted that. Yeah, I can't stress enough, we want you to stay vigilant. That snapshot in time is only that, and we don't want it to give you a false sense of security, like I'm negative, are you negative, let's get together, because we don't live in a bubble, and we know there is community transmission of COVID, and we know that like people have to be humans and still go to the grocery store, still potentially see loved ones, still move around their space. No, there's not an electric fence around campus during quiet time. So we would like you to limit your movement as much as possible to be safe and to get used to like what being on a college campus in a bustling urban area in a pandemic is like. Not so much the like, we did it, quiet period's over, let's do this thing. Think of it almost more like practice for what the rest of the semester may be for you, and keep remembering this will be over. We can do hard things for a short time. Keep those vulnerable folks at the top of mind, whether that's you or a loved one. Okay, so yes, the tests are just a snapshot in time. That's not a Hamry Center activity, that's a college activity. So Jen and I know many things, but not all the things about that. I do know that you will some have already gotten results. So those that were tested on the day one have already gotten those results. There will be a dashboard where we are summarizing results, whether that came from the Hamry Center or whether it came from that round of asymptomatic testing. That will be community and probably public knowledge for folks. And we will be updating number of tests, number of people in isolation, so on and so forth, weekly, like you've seen at other campuses that are already up and running. St. Olaf is an example that has a dashboard, and ours is nearly ready and will look very similar to that. No, your name will not be announced. When we say it's a reportable illness, we, the medical community, are still very protective of individual names. You are an adult person with all the rights to privacy and confidentiality that you should expect. So it's reported to Minnesota Department of Health, and they don't use your name even when they're typically doing contact tracing. They will just call somebody and say, you have likely been exposed to COVID. We got your name and contact info. They don't even necessarily say who. People can typically put that together, and you are free to share with people even before a contact tracer tells them. And then they can seek advice from us when the time comes. I feel like I veered off topic a little bit there.
No, I think you got that. And this will be a question that is sort of in that gray area of things you know really well and things that you may know less about. Is people are curious, when do we get tested a second time? And then after that, how often might testing happen, or should we only get tested if we have symptoms?
Perfect. So yeah, we do know that they're repeating that second round of asymptomatic mass testing in roughly 2 weeks. So stay tuned for that. We are not doing periodic asymptomatic testing. Those aren't the guidelines right now by Minnesota Department of Health to do mass asymptomatic testing. It's not that they're against asymptomatic testing, they're just for asymptomatic testing strategically. So if we had an outbreak, for example, in a particular residence hall where we're starting to see 2, 3, 4 cases, that might be an argument for an asymptomatic screen test of everybody on that floor. They will work with us, Minnesota Department of Health. For those of you who don't know, Minnesota Department of Health is pretty much tops in the country in terms of effective public health management. So we are very lucky. Jen and I and many others have been on a call every week, like religiously, specifically talking about COVID management in higher ed with MDH. Again, I digressed again. Jen, we're all over the place. What were we supposed to finish there?
No, so you were answering both. We know we're doing that asymptomatic mass testing. We've done it once. We will do it one more time. But currently, the plan after that is really, can you talk a little bit about the testing that the Hamre Center will be doing?
Perfect. So Hamre Center is doing sort of the medically indicated MDH recommended testing, which means testing anybody who's got symptoms of COVID and anybody who meets that definition of close contact. We know we want close contacts to be tested about 4 to 5 days after their exposure. But yes, we have testing every day in the Hamre Center from 2 to 4 in the afternoon for symptomatic folks, and that has already started this week. And then in early September, we will also have weekend testing available. We're working really hard to get that ready, and we're just about there. I believe it'll be ready by September 5th.
Great. I'm going to veer into behavioral questions. We had a couple behavioral questions, and then after that, we'll talk a little more about some things we might know about the quiet period. We both had questions from people who were talking about, what do I do if I see someone touching their mask too much or wearing their mask improperly, but also, what should we do if we encounter or know someone who's not following the guidelines? So I've been working on a behavior and cultural change group with, we have folks from all over campus, including students in that group. I'm partnered, you've probably seen Lisa Brook, who's our Director of Health Promotion, in videos already. And we're working together because we recognize, the Minnesota Department of Health recognizes, we are asking for behavioral changes that normally take years to happen in the space of a couple of weeks or a couple months. So we know that we're not going to be perfect. We know our nose is going to itch. We might touch our mask. We know that we might sometimes forget our face covering and have to go back, right? So I just want to start out by having some grace that this is a new set of behaviors. And if we can assume the best intent in folks, but it will happen, right? That we'll come across people who maybe aren't doing the things about what it might mean to uphold the community commitment. So a couple of things that came up in our group that we talked about, and you know, as you learn about me on campus, you'll know one of the things I do is help think about active bystander behaviors. When something's going on that might not be okay, how do we get more information? How do we interrupt that? We thought about, like, how do we find ways to call people in instead of call people out? Because shame usually kills learning, right? Like, if you come up to someone and be like, why aren't you wearing your mask, right? Their first reaction might be to be defensive. So some things that might be good strategies are posing it as a question and say, you know, I don't know if you know, but, you know, or did you know that even outside, if people are going to be closer than 6 feet, we still need to wear our face coverings. Give some grace that someone may not know that, or make it inviting as a question. We also talked about, right, thinking about how some of these behaviors keep all people safer, right? So when someone gets too close to me in line at the grocery store or whatever, what I usually say is something like, hey, I want to keep us both safe. So let's stay 6 feet apart, right? Rather than you are somehow making me unsafe. And then lastly, anything we can do, right? To remember, like, we all share an identity as folks from Macalester and using we language instead of you language, right? So, if Steph is suggesting something that doesn't really feel in alignment, I could say, hey, we need to remember we don't do that at Macalester right now because we're trying to keep each other safe, rather than, Steph, you're making a bad decision, right? So, but know that there's going to be ongoing messaging for all of campus going out throughout the fall, both those nudges, right? Because, over time, 6 feet will start, like creeping in. And how do we keep giving nudges of thinking about, let's remember physical distancing, even as we're getting comfortable with the rhythms of campus, or cues on how do I have those conversations? How do I have a couple of things I might say if someone is not upholding the guidelines and I feel like I'm in a situation that doesn't have such a power disparity that I could give that cue. So thinking about those things, really important questions, because it's going to take practice for us to make these behaviors our regular behaviors, right? I'm so used to walking outside and taking my keys and my cell phone and my wallet. And now I'm like, okay, keys, cell phone, wallet, mask, and hand sanitizer, right? That's still a new habit for me. We have some questions about the quiet period. And this is going to be one of those things that I think Dr. Steph and I can give you some general lenses to think about, a general kind of bucket to put it in, but we might not have real specifics. Questions include, can we exercise outside off campus during the quiet period? And I'm sure Dr. Steph has some things to say about it. My first instinct is to say, it depends what you mean off campus. I'm a runner. If I'm running by myself on a non-crowded trail off campus, I feel like I'm not increasing risk for anybody. If by off campus means I'm going to join a gym and go in where lots of people are breathing heavily, I would not think that that would be a recommended behavior during the quiet period. Can you say more, Steph?
Ditto. Yeah, you got it exactly right. I used to be a runner, but now my favorite thing to do is to lift weights. And I am not ready to go back into a studio setting, even if everybody is 6 feet apart. All that, like that hot breath Kevin got on me earlier, like that's a lot of exertional breath in one space. But yes, absolutely, use your common sense. If that means a walk down by the river on a non-crowded area, a bike ride to explore, by all means, yes.
Mm-hmm.
And I want to acknowledge too, Jen and I can see there are dozens of questions coming in, and some of them are either we don't know the answer to, we're not the right person. So I just want to make sure for those of you that aren't seeing the chat to please email health response, and we will get to those questions, or they will get them in front of the people who can answer them more specifically.
Mm-hmm. Related to that question, can we get takeout food or coffee during the quiet period? And I'll share, I've only been working at Macalester for about 10 months. So when I meet students, I always ask them, why did you choose Macalester? And so many of them say, because it's in the Twin Cities, it's in St. Paul, right? I moved from a small community with one coffee shop, and now I passed 5 coffee shops on my way to work. So I get the appeal. We want to think during the quiet period, limiting those trips off campus to essential trips. So anything we do to minimize that exposure and that interplay between campus and off campus during the quiet period, we want to make that choice. And remember, right, like we can do hard things for this period of time. Related to that, people wanted to know if they can visit the bookstore, especially for picking up books during the quiet period. And the answer to that is yes. And we know that Macalester's bookstore, so number one, it's essential if you need books for class, though they do have some pickup options. But we also know they're following really great protocols, right? So people are wearing face coverings, things are being wiped down. Really importantly, they're only allowing a certain number of people into the bookstore at a time, right? We're thinking about how do we create an environment where people are most likely to be able to maintain that 6 feet or more of distancing and limiting that shared air. We've got a couple questions about sex, Steph. Should we refrain from having sex during the quiet period? And I just want to say, like, mad props for asking that question. That's probably on lots of people's mind. We need people to ask those questions so that we know that people are thinking about it, so we can give you the information you're really interested in. Related, how do we deal with having sexual partners outside of our pod or someone in our pod having partners?
Y'all, so much empathy. These are the tough questions. Like Jen and I early on were communicating, like all sorts of folks talking about college campuses and what to do and physical distancing, and not a lot of great information out there about navigating sexual decision making in the time of COVID or a pandemic. You are people with autonomy and humanness and desire for connection, intimacy, pleasure. That is all still very valid and important. Neither one of us would probably say yes or no to refrain from sex during the quiet period. I can't like bring myself to do that, because why? We don't live in a bubble. There's community spread of coronavirus, but technically, like, you are taking, well, yeah. I was trying to think, is there anything you could do sexually and still be 6 feet apart? Well, it's not easy to do, but basically, like, shared breath space is the most challenging thing you can do. As I said, if any of you watched the orientation videos, I mean, most of my talks have like penis or vagina or multiple other words in it, anus, and that one was no exception. The safest sex you can have is sex with yourself. Masturbation is a very safe sexual activity. It might reduce stress. If that's something that you enjoy, please continue to do that. If you have a safe partner where you can have like electronic communication and pictures or FaceTime sex or whatever you want to do, that too is safe from a coronavirus transmission standpoint. How to navigate, I'm in a pod with these 3 people, but I want to have a sexual or intimate relationship with somebody who's not in that pod. Jen, I don't mean to put you on the spot, but you and I have chatted about this. These aren't easy conversations.
Mm-hmm. I think it goes back to that consent conversation, asking the other people in your pod, because, right, your pod would no longer be a closed circle, to talk to the other folks in your pod about how they feel about that. And as is important in every consent conversation, asking that question in a way that they can freely say no, right? Because, that would be really important, but recognizing that that closed circle would no longer be closed.
Yeah, I love that. And so just to piggyback on that, another thing I think is really important to do, as well as, calling in instead of calling out. And part of our community contract, though, is to speak up and share when folks maybe could be doing something a little differently to help protect those around them. I have witnessed a little bit, maybe in sort of younger teenagers, less so than young adults. It's maybe not cool to observe physical distancing rules, and it's more fun or edgy to flaunt that risk. But what I want for folks is to feel comfortable doing the right thing. And so when we agreed to see another family outdoors, the first thing we said was, like, no shame if this isn't comfortable to somebody else. Totally support anyone who wants to wear their mask. I just met a friend for an outdoor walk. We both walked up with masks on, and I said, hey, Andrea, we're both outside. I am comfortable to answer somebody else's question since we're basically alone in the woods. As long as we're 6 feet apart, I'm comfortable taking off my mask for that. Are you comfortable with that? So we were practicing an everyday consent, talking about our own risk tolerance, using pros and cons to weigh what we were about to do together. And she was like, I love that you asked that. Somebody just made fun of me for wearing a mask like as I walked in and out of Target. So don't be the person that's making fun of folks for doing the right thing. Make it a safe and easy place to have a discussion that is truly consensual.
Right. And again, that makes the whole environment more comfortable for everybody, right? You know, when I think about the statement of belief for Macalester, there's so much in there about mutual respect, and it's respecting someone else's autonomy. It's respecting their right to feel comfortable and to feel safer. Really briefly, there's just a couple questions about when can we start forming pods, or I've gotten to know a lot of different people sitting outside in circles and chatting with masks on, unless eating or drinking. So I love that PSA they embedded in there. Good job. While sitting 6 feet apart, like interacting with a variety of different groups, how do we go about establishing pods while still getting to know a variety of people? And I have to say, right, like you've touched on, one of the most exciting things about starting college is you're meeting so many people from so many places. And you're also like not sure yet, like who is going to be in your close friend group, right? So what I love is like what my advice would be, and this isn't, we don't have strong like medical advice on when is the best time to form a pod. I would say take advantage of this new time and the new, you know, the nice weather to keep getting to meet a lot of people and find out like, who do you keep wanting to go back and talk to more? Who might you want that, you know, shared space with? And I know, right, I think for the time being, you can only go into your own residence hall. You're not visiting other residence halls. So I'm a Midwesterner, so I'm really practical. I would think about having some of those people be in my own residence hall if there are people I connect with in my residence hall, because then it's more likely that it's okay for us to hang out indoors. But Dr. Steph, what do you think?
Nothing to add except we hear you, and it's a lot of pressure. I mean, navigating relationships in a new environment has never been, well, is rarely the thing that people say, this is the easiest thing about college. It can be fun, but it can also be hurtful, and you can feel a lot of pressure, and you can feel like if I don't have a pod or I'm not invited to the pod, it's the same thing as not being invited to the dance, so to speak. So I guess I'll just put a shout out in there that Hamre Center does a lot of stuff that isn't COVID. And if you need support for mental health or anxiety or the challenge of having OCD in a pandemic or anything else that you're navigating, please know that this is a place that you can come to and you'll be met where you're at with support and without judgment, and that making space for you to have distress over these things is our job. It's what we do all the time. And there's this added layer of COVID, and it will probably be telehealth. Not very often are these appointments in person, but we are eager to connect with you and help you navigate that.
Yeah, you know, and one last point on that, one of the students on our behavior culture change committee said, you know, she's living off campus, but she has a house that's a pod, and they take it really seriously because several of them are working healthcare jobs. But that they had a discussion about what do they do when someone wants to leave the pod or join the pod, and really came up with like, there is a 2-week quarantine waiting window when someone's leaving one pod to come into a next pod, right? And I really thought that was thoughtful, because even for people who aren't first years, friendships grow and change, and people gravitate in different directions. They meet people in a class, they outgrow or change in a friendship. So recognizing it could feel right now like pods are a game of musical chairs, but there's time, and there's going to be ways to think about if you need to change what that group is. There's ways that we can help coach you in thinking about how you can do that in as safe a way as possible. I know we're coming up at the end of our time, and I know there's so many more questions, and the team here today has been doing such a good job at directing you to websites that answer those questions. That health response one, some of those questions that are about behavioral and cultural things will get directed to that group so that we can be messaging out regularly about that. I will also encourage you, there's information about COVID and behavior and things every day in the MAC Daily. So keep reading that. But one last question for you, Steph. Can you go to the Hamre Center for any health needs that we have at any time? Do you have to make an appointment? also, can you get condoms there?
Yes, we have multiple different barrier methods. You can still request safer sex things. We still have emergency contraception. We still do so many things that aren't COVID related. But for those of you who are returning students, it's not really a pop in anymore because we're working really hard to limit traffic there. It is, let's think about this. It is the one place on campus where we kind of know we will have COVID because that's where all the testing is happening. So we're working very hard and following a lot of protocols to sort of not mix hot and cold, if you will. So we've been having appointments already this week and we're open for full-time business next week, but do please call ahead or go online. There are some appointments you can schedule online yourself.
Great. Do you want to wrap us up, Steph?
Just to say, I hope that we get to remind you this is temporary. We can do this. Please do send questions that we didn't get to Health Response. I can see dozens that we didn't get to, but we just touched on. We're very excited to help build community with you. I'm so sorry Kevin jumped off the chair, but I will try to give you a goodbye view. And I'm eager to get that therapy dog program up and running again.
Mm-hmm.
All right, take care.
I just want to thank everyone and say, you know, I know this is probably not the college experience you imagined 6 months ago, but also there has never been a better time to be part of a living and learning community, right? And to be in community with other people who are navigating this alongside you. So we're here in it with you, and we're going to keep in communication and supporting you all the way through.
Take care, everybody.